So we conducted a study of over 1,800 people across the United States, across 7 different cities. These are all people that have a heavy smoking history, and we looked at ozone exposure over the 10 years previous and linked it to several respiratory outcomes. This included higher levels of emphysema and gas trapping on CT scans, as well as an increase in respiratory symptoms, including higher shortness of breath and respiratory symptoms that lead to medication use for the treatment of patients with COPD. So ozone exposure had added detrimental impact to the effects on respiratory health in addition to smoking. So all participants in this study had at least 20 pack years of smoking history. Ozone was found to have an independent association with multiple respiratory outcomes. So the ozone levels that we saw in this study are difficult to compare directly to EPA guidelines because we took average ozone levels over a longer time period. However, overall, it is very apparent that the ozone levels were relatively low across different areas in the United States. Despite having some areas with relatively low ozone levels, there does still seem to be a significant impact with increasing ozone levels even at these lower levels that we would think might be safe. Thus, it is apparent that ozone levels, even at what we might think of as healthy levels, still have detrimental impact. I think that the importance of this finding is that we should aim to have the lowest level of ozone possible across areas in the United States to maximize health.